How to treat a migraine, Part 1. If you like the video, give it a thumbs up and share it with your friends. For more videos and tips, subscribe to the channel. Migraine is a primary headache disorder characterized by recurrent headaches that are moderate to severe. Typically, the headaches affect one half of the head, are pulsating in nature, and last from a few hours to 3 days. Associated symptoms may include nausea, vomiting, and sensitivity to light, sound, or smell. The pain is generally made worse by physical activity. If you suffer from migraine headaches, you know that they can be very painful and last hours, even days. The pulsing one-sided pain, possible nausea and vomiting, blurred vision, and light and sound sensitivity can be debilitating. Fortunately, you can treat migraines naturally and with medications. You can also learn to avoid headache triggers. Confirming the diagnosis. 1. Distinguish migraine symptoms from other headaches. Before trying to treat a migraine, you want to be sure you really do have a migraine and not another type of headache. Migraines generally occur as a throbbing pain on one side of your head along with nausea or vomiting, and/or noise and light sensitivity, though it is possible to have a migraine and experience no head pain. You may experience forewarning signs an hour or two before the migraine, such as blind spots, auras, flashing lights, weakness, tingling, or even difficulty speaking. They usually last from 4 to 72 hours and feel worse when you're being active. Know the basic features of other types of headaches, and consider whether your symptoms seem more like a migraine. Tension headaches. It feels like a tight band around your head or a weight on your head, often with neck and/or shoulder tension. They occur without throbbing, nausea, or vision changes. They are the most common type of headache, causing mild to moderate pain. Cluster headaches. It causes extreme pain usually over one eye, temple, or forehead. Pain tends to come on quickly, lasts 5 to 60 minutes, then disappears for a time before returning. Sometimes your eye will water or nose will run on the same side as the headache. These are the least common types of headaches. Sinus. It can make you feel sick and miserable. For more videos, subscribe to the channel and don't miss the part 2 of this video. Without good treatment, it can last for months or even years, although typically long-term sinusitis is not from infectious causes. What's worse, one condition can worsen the other. Sinusitis has been associated with more severe cases of asthma. So, not only does having asthma increase the odds of getting a sinus infection, but a sinus infection can make your asthma harder to control. 2. Visit your doctor for a referral to a neurologist. If you suffer from frequent or severe headaches, your family doctor can refer you to a specialist called a neurologist. This doctor can diagnose your headaches by doing a physical exam, talking to you about your symptoms, and discussing your family history. This is usually enough to diagnose migraines or other types of headaches. If your headaches are severe or abnormal, they may rarely have you do more testing such as an MRI, magnetic resonance imaging, or CT, computerized tomography, to rule out tumors, bleeding, or other problems inside your brain. A blood test to check for toxins or infection in your body. A lumbar puncture or spinal tap to check the pressure in your skull and rule out other problems. 3. Know the warning signs of an emergency. Even if you get migraines frequently, don't ignore the warning signs of a more serious problem. Some types of headaches can indicate dangerous medical conditions. See your doctor right away or visit the emergency department if you experience any of these symptoms. A severe headache that comes on suddenly and feels like the worst headache you've ever had. Headaches with a stiff neck, fever, confusion, seizures, weakness, or difficulty speaking. A headache after you injure your head, especially if it worsens over time. A headache that doesn't really go away and gets worse if you move quickly, cough, or strain. You develop headaches for the first time after age 50. Migraine with aura. where there are specific warning signs just before the migraine begins, such as seeing flashing lights. Migraine without aura, the most common type, where the migraine happens without the specific warning signs. Migraine aura without headache, also known as silent migraine, where an aura or other migraine symptoms are experienced, but a headache does not develop. Some people have migraines frequently, up to several times a week. Other people only have a migraine occasionally. It's possible for years to pass between migraine attacks. This is Kate for Nature Cures. Don't forget to subscribe to our channel.